BCAT, we're starting. BCAT, we're starting.
Yeah, they can hear you on BCAP. They just can't see anything yet. Now we're on.
Good evening, everybody. I'm going to call this meeting to order. This is the first ever remote meeting of the Burlington Board of Health. I'm going to first ask elected board member Libby Wallenjevich to please speak and recite the Pledge of Allegiance. Libby?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much, Libby. Our first order of business is the approval of minutes from March the 10th, 2020. From what I can see, we were all there. Do I have a motion to approve?
So moved. This is Mary Beth.
Second, Libby.
Now, I have to make, as we will see, roll call votes on every vote that we make to this evening. Is there any discussion? If not,
Mr. Chairman, one discussion, please. On the,
yes.
In fact, probably a change. I just noticed under the King Bibby's discussion topic, it says Dr. McSweeney down the bottom, and although I am a good student, I am not a doctor, but I think it was actually Dr. Saltzman that raised that question. So if you just make that change, I'm fine with it beyond that.
Okay.
I will make that change. Thank you.
So now I can call David McSweeney. Please vote.
Aye.
Would you? Mary Beth Welch.
Aye.
Libby Wallenjevich.
Aye.
And I vote aye. Dr. Saltzman, as we'll hear in a second, is on another priority call, and he will be joining later. So it's 4-0-1, please. Citizens time. I don't think that anybody has called in for citizens time, so I can move to the chairman's report. Good evening, everybody, and as I said, welcome to the first ever remote meeting of the Burlington Board of Health. My name is Dr. Ed Weiner, and I'm chairman of the board, and I'm joined by David McSweeney, who is vice chair, Mary Beth Welch, Board of Health member, and she is the professional that will be leading our IT processes of this call. Libby Wallenjevich, that you just heard, who recited the Pledge of Allegiance, and Wayne Saltzman, MD, who is a Board of Health member and who is on a priority call and will be joining us hopefully later. In addition, we have the Director of Public Health, Susan Luminello, Environmental Engineer, Christine Mathis, Supervisory Nurse, Christine Pollock, and Dawn Cathcart, who is our recording secretary. As you surely know, we are in uncharted waters. Every non-essential activity has been canceled or postponed. Schools, preschools, weddings, religious services, and even funerals have been affected. The Board of Health has not only been working with the police and fire, but with every department, board, committee, and commission within this town. Every department head is, and every town employee has been working to maintain services within this municipality. Specifically, I want to thank the police chief, the fire chief, and most all, Paul Sagarino, our town administrator, who has been so excellent. And really, I cannot say enough about all of the professionals and the elected board members of the Board of Health. We have an outstanding director, Susan Luminello, who has been working around the clock since the beginning of this pandemic. All have worked so hard to keep all who work and all in Burlington safe, all the citizens safe. They all have put in hundreds of hours to protect this community. And we're all tired, and it's just begun. Many of you and many of us are already frustrated with everything that we have already done to stay well. I'm going to ask right off that everybody in the town of Burlington please understand that this may not only be a start, but this may continue for a while. We need to work together to keep everybody safe and well within this town. We ask you to be patient with us. We are doing our best to provide you the best of services and support. We want to keep you well. I'm so proud of this community. I'm so proud of this town. We will continue to work together, doing what needs to be done. If you have any questions, feel free to call us tonight during this meeting or the Board of Health tomorrow. I urge you to review our Board of Health website for regular, sometimes more than once a day updates. We are here to help. And please follow public health instructions, many of which you probably know by heart. And we wish you good health. With that, we go on to the citizens' time. I don't think anybody's called in. I've just made my chairman's report. I don't believe there are any subcommittee reports this evening. So to that end, before we even begin our meeting in total, I need our vice chairman, David McSweeney, to please read the Massachusetts requirements for a remote meeting.
Thank you, Mr. Chairman, and good evening, everybody. This open meeting of the Board of Health is being conducted remotely, consistent with Governor Baker's executive order dated March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting laws to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with the agenda on the meeting website, allows public bodies to meet entirely remotely, so long as reasonable public access is afforded, so the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation, but such participation is required by law. This meeting is being featured publicly on BCAT. Mr. Chairman, that's all the notes. I can turn it back over to you for the rest of the meeting.
Thank you very much. Also, for tonight, will we employ the following ground rules? Our meeting will be recorded. Each person, when they speak, please state their name if they're not already introduced. Try to look in your remote camera. Please mute your electronic device when you're not speaking. And everyone, please be patient. This is new for all of us. Under discussion, COVID-19 updates. I'm going to turn this over to our Director of Public Health, Susan Luminello, at this time.
Yes, hello, thank you. So I wanted to provide brief overview of the things that we've been doing past 2 weeks around COVID-19. So we have been working very closely with other town departments and the town administration to make sure that town employees are safe in their workplace. And then later on, we had to follow the governor's orders, and we were looking at essential employees. So right now we're at the point where we want to make sure that town's essential municipal functions continue to run, and we have implemented strategies around that and mitigation measures so that we can ensure that that happens. We are also working on governor's orders and enforcing those. So we've had several orders that have come out in the past couple of weeks, and we've reacted to each one of those. Most recently, yesterday, the governor's orders on the closure of non-essential services. So we have a list on our website of everything that is considered essential services. We are going through that list, making sure we are contacting those businesses that cannot remain open, having a conversation with them about that. We are continuing to inform the public through our website, and as was previously discussed, we're continuing to update our website on a regular basis. And through our public health nurse, we are doing contact tracing of COVID-19 positive cases and their contacts. So that is something that our public health nurse is doing. And I am working with her to ensure that we are meeting all the requirements that we meet and that we are going to be able to remain staffed in that as long as this could go on for a while. So one of the things that we're looking at is how to get the public health nurse some help in that area. So we're looking at the possibility of using medical reserve for nurses to help out with that. We've also received funding from the state in the amount of approximately $10,000. So I'm working with the assistant town administrator as to those funds and what can be used, what we can use those funds for. We're looking at things like it would be around isolation and quarantine requirements, contact tracing, things like that. So the whole list of funds can be used for. So with that, I guess I can answer any questions that anybody has about what we've been doing and if I can provide updates on other things.
Any questions for Susan?
Susan,
Susan, please, anybody?
Mr. Chairman, this is Mary Beth Welch.
Yes.
Susan, I thank you for mentioning and providing that update. And is there a timeline where you may bring in extra support for the nurse? Is there something that's already planned, or is it are you doing that as a day-by-day basis?
So that is something that I'm starting to plan for now because we are expecting a lot more cases, a lot heavier caseload. So we use ABIN, which is the Virtual Epidemiological Network through the state. And anyone on would need training and possibly a login to get onto that system. So that could take a little while. So right now I'm looking at that possibility. I'm trying to get the person or people trained, possibly logged on to that so that they can exist.
Thank you.
Anybody else? I have two quick questions. The first, Susan, is will there be a second allotment of grant money? I heard that today on the Massachusetts Department of Public Health call this afternoon. Could you note something about that?
Yes, so we were told that I'm getting a bit of echo there. I don't know.
Ed, mute
Yeah,
your
you
phone,
need to
Ed.
go on mute. Thank you so much.
Yes, so we were told that we would get a second allotment. As far as how much that is, we don't know. So the state is using different mechanisms to get the grant money out to the individual cities and towns. Our mechanism is through the Massachusetts Health Officers Association, and this is the first disbursement. And if this continues to go on, should be seeing another disbursement.
Thank you very much. And the second question is, you noted last night in front of the town at the Board of Selectmen's meeting, the websites that the town and individuals in town can get more information about what's going on. as well as the Burlington Board of Health website. Would you just repeat those on camera?
Yes, so everybody can get information on burlington.org, go to public health alert. But I think you're referring to the question that was asked of Dr. Saltzman, where what is the most reliable information? And his answer to that was Massachusetts Department of Public Health, CDC, the World Health Organization, and National Institute of Health. So you can get linked to all of those websites from our main page.
Thank you very much. I think we go now to our supervisory nurse. Is she on?
Yes, I am. Good evening.
This is our supervisory nurse, Christine Pollock.
Hi, good evening. Do we go over my report? I have, I guess
Now, anything you'd like to add? Anything you'd like to add to Susan Luminella's, our director's report? I know you're going to have your own report this evening, but there's
okay.
anything you'd like to say now?
Just a couple of things that people know that, the governor did put in a stay at home for the next 14 days or so. That if people have these symptoms, which basically the three major symptoms are a fever, which is a high fever, a cough, which is dry cough, and it's a consistent kind of cough, and also some shortness of breath, especially in some severe cases, can possibly turn into pneumonia. So we want those people to call their provider. I do have some people calling the Board of Health with symptoms when I'm trying to tell them to call their own provider for assistance. And then they would have to be seen by them, or if that'd be up to the provider to see if they would need to go somewhere to be tested for COVID-19. And also good hand washing and keeping the social distancing that is 6 feet away from somebody from no more than 15 minutes or longer. That should not be happening. And then also, hand washing for 20 seconds, wiping things down. And you should be doing this at home. Hopefully nobody is really going to work. But if they do, if they're essential personnel and they're ill, please stay home. That's one of the big things is please stay home. We do have community spread with this right now. And right now, little minor symptoms are showing up and people are testing positive for those. So we want to make sure people stay at home when they're ill.
Does anyone on the board
Let me mute.
please mute your devices? Does anyone have any questions for the supervisory nurse? Thank you very much. We can move on now to staff reports. Environmental engineer. We have Christine Mathis, as you know, she is our environmental engineer. Christine, can you please summarize your report? Christine, you may be on mute.
There we go. At the last meeting, I informed the board and the public that Household Hazardous Waste Day was still going to be conducted. We have since decided to cancel that, so there will no longer be a collection on April 18th. So again, Household Hazardous Waste Collection Day has been canceled. Are there any other questions on my report?
Does anybody have questions for our environmental engineer? I guess not. I guess you're off the hook. Could you just please note, are there any other things that you are doing differently now than you were prior to this pandemic? I know you're very busy doing many things to ensure that our businesses and our community stays environmentally safe. Is there anything specific you'd like to outline, or is this business as usual for you?
Um, shifted focus a little away from doing routine household hazardous waste inspections. I'm sorry, hazardous materials inspections. And I've been assisting the director and other staff in contacting businesses that should be closed. First it was, or have 25 gatherings of 25 people or less. So I was assisting with contacting faith-based institutions, gyms, the hotels, clubs, other places that would have areas where people could congregate, like clubhouses and stuff like that. So a little bit of shift of attention there.
Thank you very much. If there are no other questions, I'm going to ask for a motion, please, to accept the environmental engineer's report.
So moved, Mr. Chairman.
A second. This is Mary Beth.
And it was David McSweeney who made the motion. So again, roll call, please. David,
Aye.
Mary Beth,
Aye.
Libby. Libby, are you on?
Aye.
And I, 4-0, please. Thank you very much. We move on to the supervisory nurse. Christine Pollock, our supervisory nurse, you're on again. Would you please
Hi.
summarize?
Just a couple of things. We did have to cancel the health fair for March 28th. And also we did hold the rabies clinic, which we had 35 attendees. Kind of a lower amount that we've had in the past, taking under the consideration what's going on. What I've been doing is been taking some residential calls, some employee calls. I've also have gone around to most of the departments and have gone over COVID-19 symptoms, talking about what they, what's expected of them, and then also if they had any questions in regards to what they can do to protect themselves, their workplace, and their home. And basically, I've just been doing case management for the last couple of weeks and putting in some extra time for that. So that's basically it that I have for right now. There's no events coming up, obviously, and I haven't had any calls for any flu vaccines since we've been for the last week or so, since I've been talking to the employees and still telling them that we do have flu vaccine available, but right now we're working from home, so that's probably not going to happen. But other than that, I think that's about it for my report.
Other questions? Other questions for the,
Mr. Chairman,
yes,
Libby,
please, Libby Wallenjevich, please.
Christine Pollock, are we getting information on individual cases in the town of Burlington?
Yes, we are.
Okay. And is it a significant caseload?
It's probably going to turn into that potentially in the next couple of weeks or so. We're seeing a rise, yes.
Yeah, I was noticing in the statistics that Middlesex County is the largest affected county in the state. Given that we're the largest county, that's probably not unusual, but I was just kind of curious.
Yes, I have spoken to some of the other public health nurses in the area, especially in the county, in our region, and they're seeing a significant increase as well. So I'm not, we're looking at Burlington, how many people come here during the day and then, they go home. And then also, we are the technology, 128 with all those technology people working from home, or, have people coming back from trips, things like that. So yeah, you're right. I mean, I think there's like 50 towns in our county, if I'm not
Yeah.
mistaken.
another question just popped into my head. Who do the people that come into town get, if they are positive, do they get reported to Burlington or do they get reported to their hometown?
So what happens is through Maven, what Susan was talking about is the surveillance through the state. Anybody that's positive that lives and resides in Burlington will come to me.
Right. Yeah.
Any of their, then I follow up with their immediate contacts, which would probably be family members, close friends.
Mhm.
Then they might have contacts such as work contacts or relatives that may not live and reside in Burlington. But I do call, we are all the public health nurses are working together so that we're advising each other of what they have for contacts that they need to follow. Once that is done, then that's sent into Maven, and Maven in turn transfers that person or contact to that specific town where they reside.
Okay. Very good. Now, realizing that the flu vaccine is a moot point, I'm just curious, when will it be too late, so to speak, to get it?
It's usually to the expiration date. So really up until the very end of the flu season, you can get your flu shot for this year.
Okay, and
Up
how
until
much do we,
July, I think it's June 30th or July 1st.
so if you do that, when can you get the next year?
And then the next year's strain won't be in. You can still get the next year's strain. So
Okay.
you might be able to get the flu shot before July 1st for this
Right.
flu season, but next season, carries different strains.
Right.
So that would be for that following year. So they would be able to get another flu shot for that following year's flu season.
Okay, and we're still fairly well supplied?
Yes.
Okay, very good. That's it, Mr. Chairman.
Thank you very much. Does anybody else have any questions for the supervisory nurse?
Mr. Chairman, this is David. One
Please.
comment or maybe clarification, if Chris could just elaborate a little bit more on it. So, just for the folks that are watching, the process for Maven reporting is no different than historically how the state reported on all infectious diseases, right? It's not just something new from the COVID virus, correct? And
That is
also,
correct.
yeah, and so maybe you can talk a little bit about that process, but also I want to make sure we're aware that, or the town, the community is aware that, this is highly confidential. It's not, I don't want anybody calling in asking about caseloads, numbers, who's infected, all those types of things, because it's a confidential process. But maybe you can explain or elaborate a little bit more on that process.
Sure. Maven is the surveillance website that we have through local boards of health to the state. It is strictly highly confidential. The only people that have access to it is people that are designated to have access to that. And it doesn't just cover the COVID-19. Where you're correct, David, it does cover all type of communicable diseases. So, we're dealing with foodborne illnesses, other communicable diseases such as pertussis and chickenpox, things like that, are also come through Maven if they're positive. That in turn, the public health nurse looks at this information and has to do an investigation. Same thing what I'm doing now is basically, the same thing that I do with other types of communicable diseases. It is strictly confidential. I have had a lot of people ask about, how many cases that we have about the COVID-19. And at this point, with it being so increasing right now, and not just that, but testing is not done on everybody. So we wouldn't be able to give an accurate number. I could tell you there's 30 right now, and then tomorrow might be 60. So it's kind of the numbers irrelevant. But when they look at the state putting out the numbers for the county, that is also taken into consideration that not everybody has been tested. So there could be people out there potentially walking around with this COVID-19, and it hasn't been reported to the state or the local boards of health.
Thank you very much. Is there anybody else who has any questions?
Just one clarification. I wanted to clarify that or reiterate what you're saying, that it's very confidential. Only a limited number of staff members has access to the database and knowing the numbers and who the folks are and what the caseload is. None of the board members have access to that information. It's highly confidential.
That is correct. The public does not have access, and the board does not have access, and neither does the Board of Health staff have access, except for the director and myself. So there are only limited people in the local boards of health that have access to anybody's information. Due to HIPAA laws, we have to be very careful that this information doesn't get out. And again, it is confidential. So when I talk to somebody, I have to tell them, that it's this confidential information. Be careful on how I process that information and who I discuss that information with.
Thanks, Craig. Appreciate it.
Mhm.
Anybody else? First, just a comment on communicable diseases and surveillance. On top, everything you're doing now, there are other diseases, and we mentioned a few like pertussis, but also influenza, Lyme disease, hepatitis C, hepatitis B, even TB. There's so much other work that's going on right now with the nurse's office, and we thank you very much. One other question. I know one of the disappointments has been our health fair. Was everybody contacted, and what was the reaction?
I believe everybody was contacted. As far as I know, we had a bunch of demonstrators and speakers, which I contacted. And I believe Sarah, our administrative assistant, and Susan, we've all been working on contacting everybody.
Chris, just 1 minute. This is Mary Beth. I'm really sorry. If you're not speaking, you just kindly go on mute because there's a lot of background noise. I'm just thinking for our folks at home. Thank you so much.
Yes, it's unfortunate that we have to cancel the health fair, but under the understanding that it is an inside event where people will be within that 6 feet for maybe 10, 15 minutes or longer, and to limit that exposure, we just, our director, we came to a decision where we should cancel the health fair along with all the other public events that's going on. Basically, is to keep the, residents safe too. Because we don't know, surfaces. This COVID-19 has been known to stay on multiple different kinds of surfaces for 2 hours up to 9 days. And then also, we don't know who's out there walking around with symptoms, minimal symptoms that could be carriers too. So we have to be very careful because that 6 feet and that 15 minutes is very important as far as the potential exposure of any type of illness, even the flu. So, and with flu being moderate right now still, if you could look at my report, I believe there was 78 cases of the flu, and that's all that's been reported. We don't know what's going, if other people are having that has not been reported. So,
Well, thank you very much. Please, I'm going to now entertain a motion to approve the supervisory nurses
So
report.
move. This is Mary Beth.
I have a,
This is Libby.
and Libby a second. Now I have to go through David McSweeney,
Aye.
Mary Beth Welch,
Aye.
Libby Wallenjevich. Libby, would you please unmute?
Aye.
And I say also aye. That's 4-0. Thank you very much. And now we can move on to the Director of Public Health. Susan, would you like to summarize, please?
Yes. So I did want to say something about the number of cases, just so the board kind of understands where we're at. So the testing in the state is limited right now. We have limited capacity for testing. So we're at numbers that we know are low in our town, low in other towns, and low for the entire state of Massachusetts, because we just haven't ramped up the testing to where it needs to be at to get an idea of exact cases that we have. So the state is reporting their case numbers, and that's on our website, and you can get to those numbers. They do it by county. But when you look at that, you don't know, is there more cases in this county or that county? Is there more cases in this town or that town? You don't know that because we don't have the testing capacity there to be able to say it. So until we get the testing really up and running, that data is probably underreported. So I do want to mention to the board that there are other cities and towns that are deciding to put on their website the number of cases in their town. If we do that, I would highly suggest that we put a note in there saying what I just said, basically that this is likely a low number. We know that there's person-to-person spread. So the numbers really are not going to tell you a whole lot. What you really need to know is that there's person-to-person spread, and you need to protect yourself and others as much as possible. So this is a board decision, I suppose, as far as what you want to do. And, if you want to go down that route or say we're not going to report the numbers. But I did want to make you aware there are other cities and towns who are posting numbers on their website.
Thank you very much. Do we have any questions for Susan?
Just a comment, Susan. First of all, and I'm sure the chair is going to, talk about this or address this. I can't thank you enough for all the work, tireless effort you put in during this time, because I know you've coordinated so much behind the scenes with many different departments. But you truly are a lifesaver during this time of need. So I really appreciate all the work. Just one comment on the reporting. I do think it's worth a discussion. Not sure how I feel about it one way or another, or how important it is one way or another, or even how many calls you're getting about those types of questions, right? It's a number, right? So how really important is it? But I do think it's worth probably a discussion at some point in time to see if it's worth putting it out there. That's all I have, Mr. Chair. Ed, you're on mute.
Is there anybody else who'd like to comment or like to ask a question to the Director of Public Health? Well, if not, I have a couple things to say, and that is, first and foremost, Susan, day, night, we've talked at 11 o'clock at night. I've talked at time well late into the evening. You're still in the office. I can't be more proud. Our town administrator, police chief, fire chief, every department head in this community has acknowledged your excellence. And I want to again publicly thank you. But I'm also proud of all of our staff, our health agents, our environmental engineer. I want to say thank you so much and acknowledge our supervisory nurse. Thank you all. But most of all, I'm so proud of this Board of Health, this elected group. David, Mary Beth, Libby, Wayne, you've done so much. You have so much for this community. There's so much going on behind the scenes. I thank you. And at this point, are there any telephone calls or any questions? I know this is kind of an awkward situation, and I'm not sure the public, this first time out, this first ever remote meeting, understands that they can call in. But is there anything, Susan, that is being listed, or I should say, Mary Beth, are there any questions from the community at this time?
Hi, Ed. This is Mary Beth. I don't see any new members or participants joining. And we could ask BCAT, but I think they would have reached out to us as well. But at this moment, I do not have anyone on the call or listed as a participant.
Mr.
Thank you so-
Chairman,
Yes.
I've been watching it on BCAT Facebook page, and there's been no comments.
Thank you very much. That is a Dawn Cathcart, is that correct?
That's right.
Recording secretary. Thank you so much. If there are no questions, again, I want you to understand that this is something new for us. Understand that there's a lot of activity going on, and the Board of Health, we hope, feels very strongly. We hope you're doing well. You hope we stay well. We urge you to review our Board of Health website for regular, sometimes more than once a day updates. And if you have very, very important questions, feel free to call the Board of Health. We are here. With that, I wish you good health. And do I have a motion to adjourn?
Mr. Chairman, it's Libby.
Yes, Libby.
I just want to add that for 200 years, we have known that hand washing is the most effective way of preventing the spread of disease. And it's important that everybody do it for protection of yourself and also for the protection of others.
Thank
Wash
you,
your
Libby.
hands.
We
Mr.
do
Chairman?
that.
Oh,
Yes.
Sorry
We
to
do that
interrupt you.
in reference to Dr.
Yeah.
Saltzman, who ends every meeting with, please wash your hands. And that's 20 seconds of soap and water. I know that hand sanitizer is difficult to get, but soap and water is very available. David.
Yeah, Mr. Chairman, first of all, I think we forgot to approve the director's notes. So I
Thank
think I have to do that formality. But before we do that, I do also personally want to thank you. I know this has been a full-time job. All of us board members do have full-time jobs other than this, and you have worked tirelessly. You could have easily have canceled this meeting, but we thought it was important that we get out in front of the community to show the leadership. So thank you for continuing to figure this out, but also putting this meeting together. You know, it is kind of clunky sitting here in your living room and wherever you're sitting and going out there, but we thought it was important. So and this was because of you that we're doing this. So I want to thank you. Could have easily.
Thank you very much. And
with that, I'll make a motion to approve the staff minutes, but go ahead if you have a comment to make.
please, we need a motion to approve the Director of
Libby.
Public Health.
Second,
Libby.
Libby.
Libby made the motion. Do I have a second?
Yeah.
Okay, who made the motion, please?
I made the motion, Mr. Chairman.
All in favor? We have to go through it again. David?
Aye.
Mary Beth?
Aye.
Libby?
Aye.
And I say aye 4-0. And now I can take a motion, and we'll have to roll call again for the adjournment.
So moved, Mr. Chairman.
Do I have a second?
Second. This is Mary
And
Beth.
Mary Beth. Mary Beth, please. All in
Aye.
favor? I'm David.
Aye.
Libby.
Aye.
And I'm aye 4-0. The people of Burlington, please be safe. Please have any questions, we are here. And I urge you to take a look at our website daily. Thank you. Good night. Be well. This meeting's adjourned.
Thanks, everybody.
Good night. Good night.
Good night.